Hey everyone, welcome to group text. Super excited today because we're gonna learn lots. As one of the two plastic surgeons on the hit series Botched, a new season is now airing on E! Thursday nights at 10 p.m. Dr. Heather Dubrow has literally changed people's lives through the procedures he's performed. He and Dr. Paul Nassif treat their patients with great respect and always end up with mind-blowing results. Terry is the father of 4 and the husband of my friend and favorite Dubrow, Heather, one of the Real Housewives of Orange County. Here to talk about life, love, and lip lifts, Dr. Terry Dubrow. Welcome to group text, Terry.
Oh, it's so fun to be here. Thanks for inviting me. I can't wait to talk to you about all these things.
Yeah, the last time we saw each other, you were the beaming, I want to say arm candy, but that's wrong, of Heather backstage at BravoCon.
Oh, we didn't see each other at the restaurant, Craig's recently? Oh, that was BravoCon.
Craig's was before BravoCon.
Okay, yeah, short-term memory loss. Yeah, BravoCon. That was a lot of fun, wasn't it?
It's crazy.
I know.
That was funny. That was my first one.
You know, it's funny. My brother, I don't know if you're aware of this, my brother was a rock star in the 80s, like a bona fide #1 album rock star.
Who?
He was the lead singer of a band called Quiet Riot.
I remember they had the big hair, and didn't they have the video where they got like thrown across some kid's room? That's
right, Metal Health. So come on, feel the noise, right?
Yep.
So Kevin Dubrow, the lead singer, right? So I remember going with him when he sold out the Forum back in '84, and we were backstage, and he opened up the curtain, and like 14,000 people. And there's Heather making fun of me right now. Say hello, Melissa.
Oh. Hi.
Hi. We're talking about your brother-in-law.
We're talking about Kevin.
He's
Kevin.
got things in his ears.
Go
anyway,
away.
Love you.
This is about me now. Go away. Go. Even though she said you were her favorite Dubrow. But anyway, and so I always thought, wow, what would it be like to be, a rock star? And then you go to BravoCon, and basically you're like a rock star there. You pull up in your car, and there's thousands of people. Terry, Heather. And so what a trip that was.
Yeah, you have to see it to believe it. But I do want to talk a little bit about your career and things like that. So, and then we can circle back to our crazy lives. Okay, so I had your partner on Botched, Paul Nassif, on the show, and I asked him the same question I'm going to ask you right off the bat. Why plastic surgery?
So for me, I'm sure he told you some incredibly dull story about a dog bite or something, right? I remember. But for me, I went to UCLA Medical School, and I thought I was going to be a heart surgeon. And why a heart surgeon? Because it was sort of the most hair on fire, life-saving kind of job you could have. You have to be cool under pressure, very good with math and science. It was sort of perfect for my kind of vibe. High intensity, I don't need any sleep. But my second year of med school, this amazing human being, this plastic surgeon, professor at UCLA, walks in, turns the lights down, and shows you this slide presentation of what he called the last true Renaissance field in medicine, plastic and reconstructive surgery. He had this really low voice. He wore cowboy boots. Anyway, he starts by showing you cancer reconstruction, cleft lip, cleft palate, burns, cosmetic surgery, microsurgery, putting fingers back on, all these things that everyone may or may not know what a plastic surgeon does besides just cosmetic surgery. And by the end of that 55-minute lecture, all my hopes and dreams of becoming a heart surgeon went out the window, and I had to do this. It was just head to toe the coolest kind of medicine, what I really wanted to achieve in surgery, which is to be able to do all these different things. Unfortunately, in my day, you had to go through full-blown general surgery training just to get into a plastic surgery program. So I did a 7-year general surgery residency with all the gunshot wounds and the cancer reconstruction and the burns and everything else. And then I stayed at UCLA for plastic surgery.
It's interesting you bring that up because I was going to ask you next. A lot of plastic surgeons that I know pivot and go into microsurgeries. My hand surgeon was a plastic surgeon. And I said to him, I'm like, one day, like, why did you change to being a hand guy? He's like, it's the same skill set in the precision and the little and the micro and the pretty. And his actual line was, I couldn't handle hearing another middle-aged woman discuss her boobs.
By the way, can I just tell you, I had the same experience in the middle of my career. There was a time where I would come home to Heather about 10 years in and go, I hate this job. She goes, why? I go, because the difference between happy and unhappy is a millimeter bump on the nose, is happy, not happy, happy, these micro changes that really were so irrelevant. And I thought all this training in microsurgery, burn surgery, congenital surgery, general surgery to do, to suck some fat out of a thigh. So I became very disillusioned with it. Fortunately for me, my life changed when Botched came.
Yes.
When all of a sudden I became a super specialist in doing basically revisional plastic surgery, as you know, on disasters. And that completely changed my whole career. And that's my version of what a hand surgeon or microsurgeon or reconstructive surgeon, I get to fix bad cosmetic surgery.
Which is a whole specialty, and we'll get into that. But when I said to him, I'm like, why? And he's like, it's the same. It's why you guys all got into plastics, which was the reconstruction. And it's really an art. And everything is so precise and has to be so perfect. You're all also very OCD, but that's a discussion between me and Heather. Okay, so if you hadn't gone into medicine, what would you have done?
So
other than probably break your mother's heart, what would you have done?
I mean, I hate to admit it, but I probably would have gone into some really nitpicky field in the law, because I find many aspects of the law to be very similar. It can be very intense, long hours, really uses your brain. I actually have a big side career as a medical legal expert, and nothing is cooler than walking into the courtroom, raising your right hand, spell your first and last name, and sitting on that stand and being examined and cross-examined. It's very intense. It's very cool. But now I get to blend both of those things as a doctor and a person interested in the law.
That's fascinating. It's a whole side thing. How did you meet your work husband?
So I had just done a TV show in 2003 and 4 called The Swan. I don't know if you remember this show.
I remember The Swan.
I was the plastic surgeon, one of 2 plastic surgeons on The Swan. And I was the first plastic surgeon hired. And then I actually I picked all the other professionals on the show. So don't hold that against me, because I know by today's standard, The Swan would never survive today's sensibilities, right?
Could you even imagine even trying to sell that show now?
Never. But so his mom and his sister came to me for consultations. They had, believe it or not, some problem plastic surgery in the past. And so I fixed them. And they had really wonderful personalities. Paul's mom was an amazing human being, and his sister still is. And we got along really great. And they said, my brother, my son, the mom, he's in his plastic surgery training at USC. We want you to meet him. I go, great. So he graduated. I was a few years ahead of him. I met him, and he goes, I was in Newport Beach at the time. And he said, listen, I'm opening up a practice in Beverly Hills. I'm an ear, nose, and throat facial guy. Why don't you come up and help me? And you can do the body stuff and I'll do the face stuff. So we actually did that. We actually, 20 years ago, temporarily were in practice together as I had my full-time practice in Newport Beach. I was just too busy in Newport Beach to continue doing that. But Paul and I worked together for like 3 years, became great friends. In fact, Heather and I went out to dinner with Adrian and Paul before they were even engaged. That's how long we've known each other. Yeah. And they were fighting like cats and dogs back then. And I remember saying to Paul, why are you marrying this girl when you really don't seem to get along with her? And then, they got married and the rest is history. But yeah, I've known Paul since way back when he was in his training.
And so how did you guys end up on Botched together?
So he was on the Real Housewives of Beverly Hills.
Oh, right, because of Adrian.
Because of Adrian. That ended for him. I was on the Real Housewives of Orange County with Heather. And by the way, I think it was both of us that sort of thought, hey, how'd you like to go on the Real Housewives? And I'm not sure Adrian was that into it at first. Heather was not into it at all. And his time on there, they broke up, it ended. And we were very good friends, and we became very sort of parallel adept at doing revisional plastic surgery. And we would talk on the phone about tough cases of the face, and I tell him what I'm doing on the body. And he says to me, why don't we do a show about fixing bad plastic surgery? And let's pitch that to Alex Baskin, who's now famous producer of 31 Productions, but I think he calls it 32 Productions, but of Housewives fame and Vanderpump fame and everything else. And let's do a show. And I said, that's a terrible idea. And he said, why? I go, because think about it. If all these wonderful plastic surgeons have attempted to fix this problem, plastic surgery, and they failed, and the failure rate is so high with this revisional plastic surgery, do you really want to put your reputation on the line and go on a national television show and show people that you failed a lot of the time? Because people don't really judge you, Melissa, by your before.
Right.
They don't say, oh, the before is a disaster. And if the after is not that good, they go, well, the before was so bad, that's at least a little bit of improvement. You have to hit a home run in plastic
Every
surgery.
time. Yeah.
Every time. And so I thought, Paul, what if we don't hit a home run 25% of the time? I go, 25% of our results are either going to be worse or not improved. It's not going to work. So I said, let's do a show about fixing congenital deformities, traumatic deformities. And so we pitched both shows to Alex because we knew him as the producer and creator of Real Housewives of Beverly Hills. And he thought, that's an interesting idea, but he didn't know whether Paul and I had any chemistry. He didn't know whether it would be entertaining above and beyond just the innately interesting part of doing plastic surgery. So he shot a 3-minute sizzle of Paul and I, sizzle reel of Paul and I, just looking at pictures and talking about how we would fix it. And I've known Paul for so long, and I always teased him, even way back in the day when we first met. And I started teasing him in the sizzle, and Paul said, what do you think? You think we'll be able to sell this thing? And I probably not, because plastic surgery could be pretty dry and so on and so forth. And they put together the sizzle, and you could immediately see we had the really interesting, fun, secret sauce relationship chemistry between us. We just did. You know, my yin was his yang, and I teased him, and he was really good at tolerating it and all this. And then to do revisional plastic surgery, even though high risk, and I thought it was kind of a bad idea, they went straight to series. And I remember, which was what?
I was going to say, what, you're in the 11th season?
We're in our 10th year of doing Botched.
Yeah.
We're really, you know, whether or not we get picked up for another season, we're waiting, but we sort of know, but we're waiting. But anyway, we did 8 seasons of Botch, and we did 1 season of a show called Botched by Nature, where we traveled around the country, which was really fun, but very exhausting. But I remember we went straight to series, and Paul and I are in New York, and you've done this a million times. You're sitting there promoting your new show or whatever, and about to go on all these talk shows. And we're sitting at a bar, and we said, hey, would you mind turning on E? Because tonight we're on this new show. So the guy turns on the show, and I'm sitting there looking at Twitter, which was very new back then, 10 years ago. Yeah. And so, and all of a sudden it goes, it's like watching Real Housewives of Beverly Hills now, Twitter feed. It's like hundreds of tweets, just tweets. It was just tweet after tweet. He goes, are people interested? I said, oh my gosh, I can't even keep up with the enthusiasm for this. So I thought we may actually have a real show here. And sure enough, it was the biggest premiere since the Kardashians. They picked up the second season like that next day, and they picked up another show simultaneously called Botched by Nature. So we're off and running. So that's how it happened.
And you didn't have to dine and dash that night.
Can I just tell you one quick story? So Botched originally was called not Botched. It was called Nip. Can I curse
Yeah.
on this podcast? It was called Nip Fucked. It was taken after Nip Tuck, the
Tuck,
TV
yeah.
show. So it was called Nip Fucked, and they were going to say F*KED, and that was going to be the name of the show. So a week before the show came out, E calls us and goes, "It's not called Nip Fucked anymore." And we were so disappointed. We go, "Why?" Because the advertisers don't like the F word in there.
Right.
So I said, "What's it called?" And they said, "We changed the name to Botched." And we hated it. And we actually we hated it because we thought it implied any doctor who had operated on before blew it.
Right.
And we thought our colleagues were going to hate us for doing a show called Botch. Turns out it's like the best title ever.
Yeah. Before we start to get shallow, I want to talk about some of the meaningful procedures you've done. Which one stands out after all these years?
So there was...
Which is the one that you still think about?
So there was this woman who came in on the second season who, they have these people who go to these illegal pumping parties where they inject non-medical grade silicone to their face or caulking material from a hardware store unbeknownst to these people's victims in a hotel room. This woman had all this done, and then over time the immune system had basically rejected the foreign body injected in her face, and she had these gigantic granulomas all over her face.
And
these
granulomas are what, like cysts?
Inflammatory masses like cysts, but they're solid, red, painful, all over her face, everywhere they were injected, right? And she literally couldn't walk down the street. I mean, it was like the Elephant Man. Right. So she came to us on the second season and she said, "Look, I've been to every doctor in this country that does this kind of thing, and no one will take me on because the chances of it going badly was so high." Because the problem is, if you have an inflammatory mass, you go try to remove it. First of all, you may cut all the nerves in the face. And secondly, it may just inflame the immune system further and make the problem worse. So we brought her on the second season and we said the same thing. "I'm sorry, we can't help you." And then it just bugged me. I just spent the next 4 or 5 months just thinking about it all the time. There's got to be a way to get these out without killing the skin, without cutting the nerves below. And then I remember 4:00 in the morning, I had an epiphany. I thought to myself, why am I trying to remove the entire mass? Why don't I go in there with some orthopedic saws and cut out the central 3/4 of the mass and just leave the rest in? Look, your face is cement anyway. It's all bones underneath the soft tissue. Who cares if it feels like cement, just as long as you can't see it? And so the next season, I brought her back. And Paul thought this was a very bad idea because, we don't want to have a disaster, a total disaster on Botch, because it could end the whole series, right?
Well, you also don't want a total disaster on your conscience.
Exactly. And and then there's this other thing, right, where if everybody tells you you shouldn't be doing something, they're saying it for a reason. So if you've got too much hubris, you take her to the operating room, they'll just say, "Oh, you did that for TV, for entertainment, 14 surgeons before you said it was a bad idea, and you did it anyway." That's human experimentation. But what I did was, the season after that, I took her to the operating room, and there was one right underneath the chin, one. And I said, "Let's just try this under local and see what happens." I did it. She healed perfectly, and I said, "Okay." And I took her later on that season, opened up her entire face, and took every single one of these masses out, closed it, crossed my fingers, and completely changed her life. And that was like one of the most impactful cases for me. Another just fast forward, super impactful. I've had all these buttocks problems where people have these injections in them and a general surgeon has to cut out the entire buttock. I invented an operation to reconstruct the buttock where you take a person's love handles and you rotate them down into the tissue, lift the buttock skin over it, and I've been able to give people new buttocks from that. So that's been very cool too.
Wow. People often come to you because they were born with a condition or a parents are not happy with. And this season already, what was her name? Rashira really said something so profound. She had all sorts of facial issues and an issue with her ear. And she wants you to repair her ear and cheek. And she tells us it's just because she wants to be able to wear sunglasses and earrings.
Yeah.
Which is something that we take so for granted. How do you not get emotionally involved? Because part of being a good surgeon, you have to have that emotional wall.
You do. And, it's funny because in the past, if Paul or I have lost it, we take a break and we just walk out. And then we compose ourselves and then walk back in. But this season in particular, particularly when a person comes in with their parents, they had a congenital deformity. And because Paul has a new baby at home and I have 4 kids and you have kids, and you know what I'm talking about with this, once the parents are there with the child and you just think, what if this happened to me? You can't help but get emotionally involved. But I will tell you that I remember very early in my career, my 2-year-old, one of my daughters, got smashed with a pail at school, and it literally filleted open her lip, and you could see all her teeth. And Heather brings her in crying with my daughter sitting there. And I thought to myself, okay, I can take her to the emergency room, see what plastic surgeon is on call. Hopefully they'll do a good job, or I can just get it together. And I trust myself because I'm an experienced plastic surgeon at this point, and do it myself. So my team put my daughter under anesthesia. I walk up to see my little baby daughter's face, and this is the one that looks like me. So there was always a special connection. Not that I don't love all my kids, but this one was like my mini me. And I walk up and I start to lose it for a second, and I go, get it together. Get in your general surgery mode, your gunshot wound mode, with the patient's unstable. And if you don't make the right move in the next 45 minutes, they're not going to survive. And I just got into that training mode. And now when I start to feel like this is too risky, this is too emotional, I just can go there. And you train yourself. I think it's a lot like, military and combat. You just find that space in your brain that allows you to be calm and to remove and divorce yourself from the normal emotions you might be exposed to.
Right. Follow your training.
Exactly.
People really have different perceptions. And I do, of course, want to get shallow because that's my happy space, right? Paddling around in the shallow end of the pool. So when someone comes in for a consultation for regular, shall we call it, plastic surgery, not reconstructive, not deformity.
We call it primary.
Primary, or trying to fix another plastic surgeon not so great work.
Right.
What's the first thing you try and assess?
My first impression is always the person as a whole. I put them in this, are they crazy? Are they not crazy? That's the first thing. Are there any red flags to their personality? Are they a contributing variable factor in the reason why they've had a problem? In other words, did they push a plastic surgeon too far? Look, if you go into a plastic surgeon's office asking for an operation, 99 out of 100 plastic surgeons with their expensive overheads and their fancy offices, they're going to operate on you. Whether they really believe it or not, that they can help you, or that they could or should help you, they're going to operate on you. I hate to say that, but it's just human nature. We lead very expensive existences with very high overhead. I never lived in that space, and neither has Paul, by the way. I can promise you, we never. But anyway, the first thing I do is evaluate whether the patient has any red flags, whether they have unrealistic expectations, body dysmorphia, and weirdly, whether you just don't like them. You meet a person and they can be a perfectly fine person. They can be friends with your other friends, but you instantly just don't like them. I will not operate on a person that pushes one of those buttons. So that's the first thing I evaluate. The second thing I evaluate is, at this point, to be honest with you, this may sound kind of arrogant, but there's pretty much nothing I can't fix at this point, because I've done 10 years of fixing the impossible that everybody else has
Right.
passed on. There's pretty much nothing I feel like I can't, if not completely improve, at least get an A- on the test, get a
Right.
92 out of 100. Nothing. All right. So I know
By
I
the way,
can
that
fix
must
it.
go over really well when your kids try and use that line on you when they bring home maybe not a great report card.
I know that doesn't work, does it? I know. That's just a good point. But anyway, so I say to myself, all right, how are they a yes, no, personality wise? Can I fix the problem? Which invariably is yes. And the third component is, what if it doesn't work? What if I
Right.
have a complication? What if I make it worse? Okay, because there's another thing when you're the botch doctor, the patient comes in, they know who you are, they're not doctor shopping. They want you to do their surgery. They're going to say yes to your consultation, which, that's concerning, because that means they're already maybe putting too much faith in you and they're not checking their gut. And you always got to check, even if you come to someone like me who has a ton of experience, it can go south. It can and does go south. We do have complications. So I say to myself, what if I have a complication on this person? Are they going to go insane, or are they going to stick with me and allow me to work through the complication to get to the other side of it? Because, you know, and that's kind of a good thing, because if I have a complication on a patient, or it doesn't turn out exactly as they want it, they know the best person to do the next tweak on it is still me.
Right.
So that's one advantage I have. They still trust me. The other thing with a plastic surgeon is, you can be the greatest plastic surgeon in the world, but if you have a complication or it doesn't heal well, the patient almost always loses faith in you. To them, you blew it. You're a loser. They think if you created it, you can't fix it. They don't have that with me. They think if I have a complication, I go, you know what? It didn't go right. Let me fix it, because I can. They go, yeah, please fix it. So that's how I evaluate patients.
What's the most asked? What currently is the most asked for surgery? Because things really do go in
trends.
cycles, yeah, and in trends. And
They do.
Also, by the way, what surgery do you find gets the best results?
So there are a couple that are really reliable, right? The ones that are really reliable, and I'll tell you the most commonly asked one, the ones that are really reliable are like the tummy tuck is like the most impressive before and after. If you're willing to tolerate the hip to hip scar, which if you've had a C-section, you're more likely to tolerate because you already have a scar anyway. But just in terms of like the before and the after, it's the most impactful on the body, because it addresses all three layers: the skin, the soft tissue, and the muscle, which separates from pregnancy. So that one is the most, one of the most common and most impactful. And then the facelift. A facelift works. It's just, you get your old face back, because, most of your facial appearance is in the bones. So if a person has loose skin, or they've gained some weight and a little excess fat with loose skin, you can make incisions, hide them very well, lift up the skin and pull it back. We love doing facelift because it's fun. It's a high-end procedure and it works. But I'll tell you, the hot trend right now, so I don't know if you've been seeing me in the media. I know you probably don't follow me. I wouldn't follow me either. But the thing I've been asked to comment most about lately, particularly on TMZ Live, is this whole Ozempic drugs thing. That's the big thing that everybody's asking me about. By the way, I'm getting my board certification by the American Board of Obesity Medicine in October. I'm going to take the test and get fully board certified in obesity medicine.
Yeah, which we'll get into in a minute, because you just brought up an interesting topic. Anyway, we'll get to that. So everyone asks you about Ozempic.
So the big trend right now is, because these drugs are so effective and they work so quickly, young people are looking very deflated, and the young facelift, the young breast lift, the young tummy tuck, which is something, normally if you have a facelift, 50s, 60s, 70s and beyond. We are seeing 30-year-olds who walked around kind of chunky their whole lives. Now they're so thin, and it happened so quickly, they need a facelift in their late 30s. It's not they need it, but that's a very new trend, very common requested thing, an early facelift.
And it's interesting though you bring that up because I also like skin tightening, all those different things. You brought up something interesting that you're going to become an obesity doctor.
Well, I don't plan on prescribing these obesity drugs
But
for
you know,
a living.
you're going to be a specialist in that as well, which folds very nicely into your main practice. A lot of people are saying now that they're finding they're working on helping addiction, and that people are finding out that it's not as bad for you as originally advertised. A lot of the fear is coming out of it. Do you find that?
Oh, completely. By the way, you've got to apply these adjectives to these drugs because these adjectives are true. Miracle, game-changing, breakthrough, life-saving. These drugs are treating the number one risk factor for the 4 top causes of death: cardiovascular disease, neurodegenerative disorders, cancer. Obesity is the number one risk factor, and these drugs literally are the treatment for this disease. What's interesting when you look at articles done in the scientific literature, and we are talking New England Journal of Medicine articles, the number one top journal, JAMA, Journal of American Medical Association, New England Journal, it not only, as you know, is treating obesity, but it is curing fatty liver disease. It is curing certain forms of chronic kidney disease. And in diabetics, it's been shown to improve depression, these drugs.
Wow. Okay, we're going to stay not shallow, but because I know we're running out of time with you. I'm a huge fan of the laser.
Yeah.
What is the best new laser treatment? Because all these lasers and these sort of aesthetic clinics and using all these really has changed, pushed back the need very often for cosmetic surgery in a good way. I feel like there's a lot of good to it.
You know, I'm glad you asked me about that because just a very brief thing that I find very interesting. So I graduated med school in 1986. If you would have told me in 1986 that in 2024, all right, you're still going to be cutting skin, lifting it, disrupting the blood supply, pulling it, whacking it off, and using stitches to tighten the skin, I would have said, no. 2024, we'll be using energy transmission, lasers, radio frequency, ultrasound, and yet they're still very weak for tightening the skin. But you're right, the future is in non-invasive skin tightening. The latest state-of-the-art non-invasive skin tightening, in my opinion, and by the way, this is one of those things where you ask 5 plastic surgeons, you're going to get 5 different opinions, but I think the best things are things that make mechanically induce microtrauma, like some form of microneedling or coring technology, and at the same time deliver energy, whether it's heat, radio frequency, laser, to cause some tissue removal, tissue trauma to induce healing, and tissue tightening. That's the state-of-the-art stuff. So those things that you can find at your dermatologist or plastic surgeon's office that combine this microneedling with either laser or radio frequency, I think those are the best things going right now. And they have very little recovery.
And are those like we all hear about, like Morpheus?
Morpheus
those are all the words, Morpheus, and we always hear about photofacials.
Ulthera.
Yep. Are those, they're not as good as an actual surgery, but are they not bad ideas? If you want a little tight, you want to look a little fresher.
They're great ideas, particularly if you're not expecting the facelift result. But we are on the threshold, okay, just like we're going to have self-driving robo cars in the next 5 years. I don't know if you've seen the Vision Pro yet, what that thing could do.
I was playing with it with my son. It's crazy.
It's magic, right? It's a new generation of technology, but we are on the threshold of converting from having to cut with a scalpel, pull, remove, and stitch to being able to do it non-invasively or minimally invasively. Yeah, so the Morpheus 8, that's one been around for a while. That can be effective. again, I'm a fan of actually inducing micro trauma to use the body's own growth factors to get the area
Right.
to heal and tighten along with energy transmission.
Okay, one last question. Who's going to retire first, you or Paul?
So, Paul, I'll tell you why. Paul has a lot of outside interests. He has a young child. He loves to do sort of business. He loves golf. He's very social. I love surgery. I am obsessed with being in the operating room. I love the hand-eye part of it. I love being in the flow. You know, when you're in really good conversation, or you just love watching, losing yourself in a movie. For me, when I start operating with the beep, 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 and I open up the incision and everybody's just focused on this individual, I love that feeling. I will be 6 feet under. That's how you know I'll be retired. I will never retire. And that's why I literally try to exercise every single day. I try, Heather gets me down there, but I do cardio and weights every single day. And it's too bad we didn't have more time to talk about this Mounjaro Ozempic thing, because I could go on forever with that and give people advice on how to take those, because I'm pretty much.
We'll do another episode, and I'm sorry we didn't get to talk about your beginnings of empty nesting and how poor Heather sobbed hysterically on the plane going home from dropping off one of the kids. And I was like, well, I was curious, how did you take it? Were you just trying to be strong but crying while she was gone?
Okay, this is going to sound a little callous. I'm sorry, but I had the exact opposite reaction. It was more like, woo-hoo,
You are not right.
I am so not right, but I'm really good with change. I always have been. Every time Heather builds a house and then sells it, it's like, I'm going to miss this house. Nah, new chapter. So for me, empty nester, I can't wait. All right. I can't wait to be able to spend time. I sort of got married later, so I've always been a grandfather anyway. The great thing about being a grandparent, I'm not a grandfather yet, but the great thing about being a grandparent is you take the grandchild and you give them back. I'm ready to give them back.
You can't. You're their father. And you got a lot more years of having them on the books. I do want to have you back to talk about all of the weight loss stuff. Terry Dubrow, watch Botched. Thank you so much.
Thank you so much. It was wonderful.